Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Hello, good morning, everyone. It's a lovely Saturday morning here and a very warm welcome to everyone joining us this day, the 26th of November 2022, on our CATHIP Health Hour sessions. So if you're attending this session on Zoom or Facebook or YouTube or wherever you're joining us from, it's our pleasure to host you today, and we're looking forward to a lovely, interesting, stimulating discussion as always. We really appreciate your time, sparing your Saturday mornings to join these sessions where we all learn together, discuss topics that will empower us and make us better in managing our own health as people from the Caribbean and African background. My name is Dr. Diana Asante, your regular host. I'm an NHS GP and the Deputy Primary Care Lead for CAHN. And we've got a very important guest here today who has been on the program so many times in the past. Now, the topic that we're discussing today is a very interesting one. And we're looking forward to learning a lot and asking questions and improving our knowledge. Today, we're going to be talking about where do stones form in the body? Where do stones form in the body? And I'm sure that people might be wondering, are some people natural stone formers? Are some people more predisposed to forming stones? Is there any way to prevent the formation of stones? What are some of the complications? Why do we even form stones in the first place? So if these or many others are questions on your mind, then sit back, relax, and be all geared up for this morning's discussion. I'd like to acknowledge our partners, the CATHIP Health Hour sessions, which is the Caribbean Targeted Health Improvement Sessions and programs, are brought to you in collaboration with CAHN, which is a Caribbean African Health Network, BHI, which is the Black Health Initiative, Croydon BME Forum, Enfield Caribbean Association, Rafa International Development Agency, and the Royal House Redeemed Church of God in Sheffield. It's funded by the National Lottery Fund. As we go through, please feel free to post your questions in the chat box, your comments as we go along. And at the end of the session by the presenter, there will be a chance for us to go through the questions and have a stimulating discussion. If there is time, we'll be able to allow people to unmute themselves as well to ask some questions or share some experiences. So I'm looking forward to a great discussion this morning. So we have none other this morning than our own A&E consultant who has been on this program so many times. He's an integral part of CAHN, and he's always ready, willing, and able to educate us, to teach us, to share his wealth of knowledge with us. Ladies and gentlemen, let's welcome this morning Dr. Mohamed Kamara. Dr. Mohamed Kamara to take us through the session on where do stones form in the body. Over to you, Dr. Kamara. And good to see you as always.
Thank you so much. Yeah, thank you for having me. A very good morning to you all. What do you do to follow that introduction? Yes, right. Thank you for that. Let's try and share. Right. Okay. So of course, as I said, that warm introduction, I need to live up to that then. So
no pressure.
Yes,
no
thank
pressure.
you. So, yes, ladies and gentlemen, we often wonder, where these things happen, in terms of stone formation. What I thought I could do is probably just talk about this. Now, I wanted to just find out as a guide, for me and maybe for all of us, who knows where stones form in the body. So, I just wanted to gauge the knowledge that we have that is out there in terms of that. So, in your minds or from your knowledge, who knows where stones form in the human body? I just wanted it to be an icebreaker. So you can come up with some answers, and it's not an exam, it's not a test. It's just a way of finding out what knowledge we have. So please come up. Where do you think stones form in the body? Anybody? No, surely you can think of one place where the stones form in the body.
There's some answers popping up in the chat box.
Okay, so I because I'm sharing, I don't think I'll be able to see.
So kidneys, someone has put kidneys.
Yeah, good.
Someone put appendix. There's throat.
It's interesting, the appendix, that's interesting. What else?
There's throat as well. Lots of kidneys. Lots of kidneys.
Yeah, it's good. It's good that. Right. Yes. Okay. That's interesting. The throat. Somebody knows that. I didn't realize people know that. But anyway, here we go. Kidney has been mentioned. Believe it or not, in the throat, it has been mentioned as well. Did you think about that? The bladder? Yeah, stones can form in the bladder, believe it or not, because they can either form there on their own, or they can actually drop from the kidney through the tube, which is the ureter, into the bladder, And then, of course, the gallbladder. This is very common amongst the female, but you have that in the male as well. They have a mnemonic where they say it's the fair ladies, they're fertile, a bit overweight, and obviously they're of the childbearing age, and sometimes, as they say, it runs in families as well. So gallbladder stones, definitely. And of course, believe it or not, now this is something I know a lot of people don't know about, the prostate. Us men, that is one troublesome gland. That's one troublesome, issue that we do have. And believe it or not, apart from the fact that it can get big, or it can actually be a source of discomfort, i.e. get inflamed. So prostatitis, and then of course the benign prostatic hyperplasia. And then of course it could be a source of cancer, but it's also got stones that can form in it. So then in the mouth, in the salivary glands, a lot of people don't know that, and that can be really problematic. When people eat something sour, something tangy, and sometimes it triggers it, and that can really cause some problems. So it's important to know that. And then, of course, next to the gallbladder, you've got the pancreas. They're like cousins. Both of them have these ducts, and one can influence the other. The pancreas, as you know, we'll talk about. And then, of course, believe it or not, in the nose. Yeah, it is there, and there's no questions about that. And in the veins, in the neck, in the veins, you can get stones. And in the head as well, you can get stones which can drop into the blood circulation, and then can cause things like possible stroke and things that are imbalanced. And of course, a lot of people don't know this, but it can happen in the bowel, because as we grow older, the bowels have got 3 layers of muscles, like 3 surrounding muscle layers. and it gets weaker as we grow older. So those can develop what we call cup handles, outpouchings. And in those, over the years, that can get inflamed and that can become a stone, So that's what we have. So let's start with the kidneys. Well, these stones that we have in the kidney, these are hard, very solid. If you look at granite, you can see that in the picture there, where they form. You've got inside of the kidney itself, and then of course the tube. Now, people can have that for a long, long time, not knowing they have it. And then one fine day, you lift something heavy, and then of course, it triggers it. And then it comes down. Now, because that tube that you can see there is tiny and it hasn't got that much muscle around it, it begins to stretch because the stone blocks the urine passing. So the urine is from the kidneys, as we know, and that gets to want to pass through that tube to go into the bladder, and from the bladder to the outside. But because that is stopped, it starts to stretch and it starts to get bigger, and that causes that pain. Which is called, what people say, the men equate it to labor pain. I don't know when a man has ever had children or gone into labor, but anyway, that's what they equate it to. It's such a painful thing that if you ever are in A&E, in casualty, and you see a young man or older man coming and said that they've got pain from the loin to the groin, so it's coming from the back to the groin, and they can't sit down. You can see them like they're riding a bicycle up and down. One of the things you can think about is kidney stones. And of course, if they tell you they've got blood in the urine, then definitely you're more likely to be a kidney stone than anything else. I can tell you this, it's very painful. There's no questions about that. And best thing to do is try and get them painkillers. Other than that, they would not be compliant at all. So as I've said, you may see blood in the urine when you pass it. Maybe just streaks of blood, something we call microscopic and macroscopic. What it means is microscopic means you might not be able to see it in the urine, but macroscopic is when it's definitely frank, like those that drink wine, they'll know about rosé. And of course, there is frank blood, which you see in the urine. That could be a sign of it together with the pain. And of course, you might see the stone. It might be that tiny that the urine is forceful enough to, sort of force it out, and you can then pass it out when you're passing water, and that might be the end of it. Or sometimes you might need surgery for it, if it's too big, like the one you're seeing now. Or sometimes they need to send you to have it like blasted, like the waves, they call it lithotripsy. So it's like where they blast it and it becomes pulverized, like in small gravel or sand. And then you can then be able to pass it. But that in itself has also got problems with it, fraught with problems. The next one is the throat. Now, if you look at the throat, as you can see there where the green circle is, the tonsils are two lumps of tissue, at the back of your throat. They help to filter the germs that we have. Believe it or not, we have germs all over the body, but the body is robust and strong enough, the military or the defense of the body is so good that it helps you all the time, and it does that for you. Sometimes people don't know that the food we eat, or sometimes the dead skin and other debris can get caught there, can decompose, can get, hardened into stones, and we call them tonsilloliths. That's a bit of a mouthful, but that's what it means. On the tonsil, there's a stone that can form there. It sometimes can present as a sore throat, and of course, the breath can be foul, can be, stinky breath, and of course, the tonsils can swell, and sometimes you can see these white spots when you look at the tonsils. You may well be able to brush it away if you're brave enough. If you're brave enough, you can do that gently, just push it away, scrub, so brush it away, and it can go away with that. Or you can use a cotton swab, or you can gargle, and sometimes that can help. But if that doesn't help, then obviously you'd have to talk to a doctor, and the doctor can then refer you to the ear, nose, and throat doctors who can then gladly remove it for you. Next one, obviously, we mentioned there was the bladder. As I said already, you would definitely have them, either they're forming in the bladder itself, or they can actually drop. You can look at the tube, you can see the two tubes, one on the right, one on the left. These are the tubes I was talking about. When the urine forms in the kidney, the urine passes through these tubes. tract, which are called the ureter, and then into the bladder. And from the bladder, that other tube that continues is the urethra, which then goes to the outside. So these stones can form in the kidneys and then drop through the tubes, if they're small enough, into the bladder, or they can form in the bladder itself, you know. So what normally causes this is because sometimes people don't urinate fully, which obviously is something I would advise against. And of course, there is bacteria that can form these stones. So they begin like sand, and then as time goes by, they begin to get bigger and bigger because they develop, they attract more sand or stone formation, and then of course get bigger. And some people might not have problems with that until they leave this world. Some people, obviously, that can just drop into that narrow space. We call it the trigone, and that would actually cause problems of not being able to pass urine. And of course, with its pain and fever, temperature, and of course, can cause infection, which obviously can cause problems for people. You know, if you pass urine, you might just notice that it's cloudy or maybe a bit of blood in it. And of course, as I said, pain when you try to pass water, you know. So if you experience all of these symptoms or any of these symptoms and you're not clear, it's always nice to have this checked, because the urine, by the time it becomes red and you see it as and notice it and recognize it as blood, it might be a lot more than you think it is. So as I said, microscopic means you can't see it with the eye. You go to the you know, to the toilet to pass water, you urinate, you just look at it and think, this is a bit dark, and that's it. It may have blood, but obviously you're not seeing it as blood. So therefore, if you're not sure, have it checked out. It's as simple as that, you know. And obviously, when they check it, they'll tell you whether there's blood in there or not. It then causes confusion with the female, especially the ones who are still of childbearing age, when they come during the period in the month, you know, the time of the month, that can sometimes cause confusion. It's something nice to remember, that if there is no pain and there's no fever, but then there's, you know, urine in the blood, and this person is of childbearing age, then maybe that might be that. But if not, then obviously it needs investigating. So they can treat it, as I said, with either surgery to try and remove it, or they can try and break it up by using the sound waves. That's why I've said, you know, the lasers. Yeah, this is just confirming what we just said in the bladder. And then, of course, this is a big one, which we know is very common, the gallbladder. Now, if you look at it, it's a small organ. It looks like a pear, the shape of a pear. And there you have the bile, which is used for digestion of fat. So when we eat something like, you know, our fried stews and things, mash and banger and, you know, bangers and all that, this is the juice that comes to play in order to help with the digestion. So over some time, you know, sometimes it causes, you know, infection, or maybe too much calcium and things like that can cause this bile to become thickened, concentrate, and then, of course, it can then begin to precipitate, so form like sand, and over time it builds up into stones. As I said, it can run in families, you know, and so you might have it, not even know it's there, because maybe it's too tiny, or maybe it gets that big, and then it stops the bile going out, or when it's required. Because only when you eat something fatty, that's when the brain tells the liver to say, hang on, someone's had some fatty food, so it needs digesting, and so therefore the bile is required. And that bile is then pushed through that tube you can see towards the gut there. But of course, you can see the stone in the way. And so because it's in the way, well, the gallbladder doesn't know anything else but to produce the bile that is required. And so it begins to get this, I call it balloon effect. So if you imagine you blowing a balloon, you know, the air gets trapped in and it wants to come out, and that's what happens. So that is stretching, and that would cause you pain. And the pain can be that bad, sometimes with nausea, vomiting, you know, temperature. And of course, because it's stretching, it can be prone to infection. And when it gets infected, obviously, you probably would need not only the painkillers, but the antibiotics and maybe some fluids to help you with that. And of course, if it happens too frequently and it's confirmed, then of course, the GP will probably refer you to a surgeon who will look at trying to see what can be done about this in terms of removing it. But nowadays, we don't open up people, not unless it's required. What we do is the keyhole surgery, which you may have all heard of, which is the laparoscope. It's a camera which is put in the belly, so it heals faster, it leaves less of a scar, and of course your time in hospital is less, so that's the gallbladder. And I mentioned this now, a lot of people don't know about this. As I said, us men, we have to pay attention to this one. If you look at that blue thing there in terms of the diagram, it's the bladder, and just underneath that you could see the prostate. This is the gland that lets us down as it is. It's a small one near the bladder, and it makes fluid to protect the sperm of the male. If you look at it, the stones here are very, very tiny. They're like the size of a poppy seed, the plant, the poppy seed, and that's what they look like. They're very common as we grow older, people in their 60s, 70s and 80s, yeah. And sometimes earlier, if it runs in family, you definitely and sometimes expect it to happen. Or maybe where they would have had an inflammation of the prostate, which is called, as I said earlier on, prostatitis, or maybe the enlargement of the prostate, which is something common. I don't know if you know about it, but November is a prostate cancer month, and obviously 1 in 4 Black men, they say, in their lifetime might likely contract that. So it's important for us to pay attention to that. I know we're talking about stones, but it's also important to talk about the possibility of cancer, because, as I say, this is the prostate, and of course we're talking about the prostate stones now. Typically, you would not need treatment for these these stones that are sometimes forming in this gland, but they can get infected, in which case you would then be subject or maybe prone to water infections, which would then require antibiotics and obviously follow-up and monitoring by the urologist, the ones that deal with the organs down below. And this is where it becomes very interesting. We're not sure why the stones form in the mouth, but they do form there. They can be painful, and they can cause swelling, and of course they may block the tubes that give you saliva. So we've got salivary glands. I don't know if people see it, but sometimes if you take a slice of lemon and just put it in the upper jaw, inside of it, inside the cheek, and squeeze it, you can actually see the saliva squirting. This is something we used to do when we were in medical school. It's a bit of a quirky joke for us, but yeah, we did that. But then, if that salivary duct, that duct that produces saliva, is blocked by a stone, that's one way of finding out. You see, you might see the stone itself, and in the mouth, you can see it under the tongue. Again, that's where the salivary duct is. It may not be anything serious, It can sort of be swiped away, if you like, and it might go away by drinking more water, and massaging the stone if you're brave enough. Or, as I said, if you take a tangy slice of lemon, that would definitely help. If not, the doctors who deal with this, they're the maxillofacial surgeons. They can help to remove this. Now, this just goes to show you, if you look at it, if you look at what I did was to actually look at the natural specimen and look at what it looks like on X-ray. So the extreme on the left picture is obviously a person of color, and you can see the swelling under the jaw, the lower jaw. And if you look at the X-ray, that is what it looks like, the stone. There's like 2 stones on the X-ray. And of course, on the right, you can see exactly what it looks like, really. As I say, it can be really painful and sometimes causes a lot of problems. So it might be too big for it to be massaged out, in which case, obviously, it would have to be removed by the surgeons. Now, this is something a lot of people don't know about. The pancreas, which is the organ behind the stomach, you can see it there in the diagram. It's behind the stomach, and next to it on the left there is that pear-shaped organ which I talked about. So the gallbladder, and of course you can see the guts surrounding. So you've got the large bowel, which is the colon, and then the small bowel, which is the small intestine, which begins with after the stomach, where you get the small bowel, the duodenum, and then of course the ileum, which empties into the cecum, where the large bowel begins. But the pancreas is just behind the stomach, and it's got this duct, this tube, that actually goes the same way as the tube of that gallbladder, where they meet and empty into the small bowel. And that is, the gallbladder will deal with the fat, and then the pancreas will deal with the carbohydrates, So both of them can influence one another. The stones can pass from the gallbladder through the bile ducts into the pancreas and cause inflammation, and vice versa. And of course, this presents with a fever, pain, the fast heartbeat, and of course, it says nausea. But one thing that the pancreas specializes or distinguishes itself from the gallbladder pain is that it's associated with projectile vomiting. So if someone comes in with pain, you can think about the gallbladder, but then if they actually are more, the pain goes across like a belt, the upper abdomen, the pain goes across and goes to the back. Whereas with the gallbladder, it's more on the right, the right upper belly. And of course, associated with projectile vomiting, then definitely you need to think about the pancreas. But if you come to us in hospital, because we're not quite sure what it is, and even if we look at an X-ray, we don't find that possible unless we have an ultrasound or a CT scan, we will do some blood tests. And based on the blood test, the main blood test for the pancreas is the amylase. And the amylase, obviously, if it's in 1,000, then obviously I'll have to suspect that. And of course, if I then do an ultrasound or a CT scan, it will tell me whether this is the pancreas on its own, or whether it's a combination of the pancreas and the gallbladder. So as you can see, if the stone doesn't pass on its own, then obviously you'd have to be referred to hospital. But I tell you, most of the people that have this, they come to us. And it could be acute, which is new onset, or it could be chronic. Now, of course, we know alcohol is a cause, and it actually can cause a lot of problems. So people they develop pancreatitis, sometimes due to alcohol, sometimes, as I said, due to gallbladder, and sometimes due to infection. And then, of course, they need to be treated in hospital in order to ensure that the inflammation subsides, lends itself readily to treatment. And then, of course, with dietary advice and lifestyle changes, they get better. Now, this is rare. Now, for mothers and maybe fathers, the children sometimes have this habit of putting things up their noses, sometimes up their ears. It's important to remember that. It may be there, and you might not even know it's there, unless maybe it starts discharging, the nose starts discharging, and you get like what we call purulent discharge. It's like yellow, green, and of course, a bit smelly, and it could be a button, it could be an eraser, it could be just a seed, it could be Lego, it could be wood, and children just have this habit of putting things up their nose. So it might be there if it's, it stays there, but sometimes it might come out. If it doesn't, then sometimes over the years, it attracts the minerals like calcium, magnesium, iron, and then it gets bigger and becomes a stone. And eventually, you might notice it. I remember somebody brought their child who they said had been having this discharge for over 6 months. And lo and behold, they remember that at some point 2 years back, this was something they suspected, but they weren't sure until they started getting this smell from the nose and the mucus that was coming from the nostril, just one of them. And when we looked at it, it was as hard as anything else. We couldn't remove it in casualty, so they needed to have it removed under surgery, but it's just important to remember that. If it is rounded like a bead, which is likely, we worry about that because it has to be taken out because there's a likelihood of inhaling it. So when you take that, that deep breath, sometimes it can land in the lung and that can cause problems. So when it's round, we tend to try and remove it on the same day. If it is something else, as long as it's not discharging, it can, take some time for it to be removed. They can remove it at, maybe within a week, within a few days. But if it's round, then clearly we need to remove it because of the fact that it can cause problems with the breathing and when it lodges in the lungs. Now, this is an issue that a lot of people did not know about, when we have, weak spots and, bumps and other problems with the veins, believe it or not. and of course the stones can form there, especially in the neck, which can then cause problems like symptoms of a stroke, and so you might not have those symptoms, but you may have pain and discoloration of the skin around the mouth, the lips, the cheek, the head, and the neck. And the vein stones may happen because blood moves more slowly towards these areas, and eventually clots are formed. And of course, these clots over time can harden into a stone, and that's how the stones can form. And when they dislodge, it can cause symptoms of a stroke or a bleed or an infarct of the brain. Obviously, when you get these, you need to remember that your doctor, you need to rush to hospital, and the doctors will treat you with the symptoms, and it needs to be. Obviously, you can then have the stones removed or the clots removed under the appropriate specialty. Yes, I mentioned this earlier. The large bowel, as I said, if you look at the large bowel, look at the diagram. The one on the right, you can see how it is proper. When you open the specimen, that's what you see. That's what they look like, And this other one on the left there is just showing you how this diverticulum or diverticulae form. As I say, they're like outpouchings. The muscles grow weaker as you grow older in the guts. Believe it or not, the guts have got muscles on them. And that's why they stretch, and that's why they actually help with moving the motions, especially the large bowel. So over time, when that happens, that pocket attracts debris and and other material, food and waste, and then it hardens when there's a precipitate of calcium and other minerals on it, iron, and then it becomes a stone. So that could be a source of infection. As we say, diverticulitis, the diverticulum is an outpouching in the bowel, and when it gets inflamed, it's called diverticulitis, and that can cause pain, that can cause bleeding sometimes in the back passage when you open your bowels. It can cause fever, and of course can cause infection, So it can run in families, because I know families like 3 generations that I've seen, and all of them do have these diverticula, which sometimes can be understandable because if you inherit the genes, they may well be the reason for that. But as I say, if at all they get inflamed and they cause infection, they can lead to sepsis, and sometimes they can cause perforation of the bowel, and that can cause problems. And so therefore, if that is the case, you get this pain, you get this bleeding from the back passage, and it's fresh blood, and of course you feel temperature, you feel unwell, then you need to be coming to hospital to get assessed. They'll look at the bloods, look at the x-ray, sometimes do a scan, and if that's the case, then obviously they'll have to admit you and treat it accordingly. And sometimes you might need surgery, which is obviously a lot advanced in terms of what they can do. There are different sets of surgery they can do for a large bowel that has got a diverticulum. So this is, as I said, a short one, but it's important for us to look at these messages. As I said, we mentioned dietary changes as well. So those of us that like our red meat, and greens and things and all that, we have to be, proportionate in what we take. Salt, is another thing that we need to think about. So we need to be making the appropriate necessary dietary changes. I cannot emphasize this second point, hydration. We need to hydrate the body because the body, believe it or not, is 70% liquid or fluid and 30% solid. So with all the muscles, the bones, the liver, the brain and all that, 70% is water, and of course 30%. So we need to maintain that ratio, and that's why we need to be drinking as much as we need to. So they say 8 glasses a day. That's important. And sometimes when it's very hot, it might be a bit more than that. Alcohol, another issue. Too much of that is not good for anyone. I don't need to overemphasize that. I think it's understandable that definitely he is pleasure, he that drinks with measures. That's what I've been told. And, I don't drink, but obviously it's important that if you drink within, measures, really. Smoking is another problem. These, issues surrounding smoking, they're plentiful, a lot of them. Most of the illnesses surrounding that we experience this, in this present day surrounding or maybe associated with these two, if you like, vices, alcohol and smoking. Professional hazards, the athletes, they do a lot of running and they don't get to hydrate themselves as they should. The military, and of course, when you're in battle, in combat, you don't get to get the amount of hydration, maybe the amount of food, the amount of rest and things. And obviously the training is so intense that can obviously leave some lasting legacies, which can be a problem. Be observant, absolutely vital. So you know your body better than even the doctor you're going to see. Listen to your body. If your body tells you that, look, hang on, there's a change here, listen to it, and not just listen to it, but act upon it. And as I said, avoid the delays, seeking assessment from the appropriately trained professionals. As you can see, be observant, note the changes, and of course, when you note them, listen to them. And when you listen to them, you do nothing else but definitely seek treatment or maybe assessment in a timely fashion. Remember, timely fashion, because a stitch in time saves 9. And that is true in many of the cases. Of course, if you have anatomical problems like maybe some people have different anatomies, and physiology. And of course, if it runs in the family, then remember that maybe, just maybe, you've inherited the gene. And so we blame the genes, but you need to actually look at the possibility of seeking advice and seeking assessment as soon as you can. Age is a big factor. As we grow older, obviously, things become a bit problematic. Race, as we know, we as people of color, we're more prone to these illnesses, and of course, gender. Some of them more so for women than for men, and the others more for men than for women. And of course, that big one that you've seen there, it may be a bit difficult to pronounce, iatrogenic, which means us doctors are the ones sometimes that cause this. So we do things, but I think we'll talk about that, at an appropriate time. But we do things, sometimes the antibiotics, sometimes the medication, sometimes the side effects of what we, advise to have are the ones that cause these problems. And so obviously we need to look at that as doctors and alter our approach to managing illnesses. Now, I thought I wouldn't finish without telling you about these myths. You might find them funny, but just have a look at them. Everybody thinks a couple of lagers, Tennant and this and that might help to reduce the kidney stones. Well, of course, the alcohol has got a diuretic effect, but it doesn't help to reduce the stone formation. Absolutely not. That's not true at all. There are medicines, homeopathic remedies, that people sometimes think they can resolve or maybe dissolve the stones. I don't know about that. I don't think there's any proof of that happening. The stones, 80% of them are formed, from calcium and the oxalate and the phosphate. So I don't think there's medicines that are, homeopathic remedies that would dissolve those. I'm not sure about that. I know the shock waves can do that, and of course they can be removed by surgery. Sometimes, as I say, opening them up, but mostly nowadays by the keyhole surgery. That's another one. Drinking more liquids, especially milk, will remove the gallstones from the body. Well, I don't know how likely that is, because the milk itself, when it's gone through the kidneys, becomes urine. So I don't know how likely that could be, that people think that the stones can be, removed or maybe flushed away by doing that. And people think sometimes adopting a vegetarian diet or vegan diet can avoid the formation of gallstones. Not likely. Absolutely no. Doesn't work like that, And of course, people think that once the stones have been removed, they do not recur. Well, there is the possibility they can recur, because the duct itself is not just the bile duct, which is the one where the organ is shaped like that pear, the gallbladder. There is one which they call the hepatic duct, which is on the right, and the other one on the left. And when they come together, these three ducts, so the hepatic right, hepatic left, and the cystic one, which is the gallbladder one, come together and join and form what we call the common bile duct. So if you remove the gallbladder, sometimes the stones can form in the common bile duct, which will then mean that they have to be removed, or they can drop, through that into the bowel, and then of course they can be passed. So I leave you be. These are my references, and I thank you very much for listening to me. And now we can probably go to the questions and answers. Thank you.
Thank you. Thank you very much, Dr. Kamara. Excellent presentation. And that was very interesting because obviously you've brought our attention to the fact that stones can be formed in various parts of the body. And those of you who got the answers right at the beginning, well done as well. So we're moving on to our Q&A session where we get to deliberate and discuss some questions, and then people can also unmute and ask questions. Right, so one of the questions that I'd like to ask on behalf of one of our attendees is, what causes bladder and prostate stones? So I know you've been through it, but clearly this attendee wants a bit more clarification on what causes bladder and prostate stones.
Well, I mean, the bladder one, like I said, there's two ways they can form. Either it's dropped from the kidney, or it's formed in the bladder itself, like I said, So the kidney stones, obviously, there's a lot of things that would cause it. The calcium, it could be the fact that the urine is more acidic, the level in the blood of calcium, the oxalate, the phosphate, all of these can cause problems. Sometimes you can get inflammation of the kidney. It can be an injury, and of course, all of that over time would begin to cause this residue. It's like a gravel or a sand or something, and it starts to grow bigger and bigger and bigger. And of course, it's important to remember that when these things form, you don't know they're there, and it may be there for a long, long time. And then one fine day, something happens, like you strain yourself and boom, you get into this sharp pain, which goes from loin to groin. And if you're lucky, you get this, fluids in, and then the fluids, encourage or maybe generate urine that gets to push the stone through that tube and passes down to the bladder. It may well stay there and not cause any problems, And of course, over some time, it might get bigger. And again, at that fine time, it just comes to that trigone, that narrow place, and then it can't pass, and that's when we feel it. But mostly, it's difficult to tell you that one particular reason will give rise to that. But from the blood, from the kidney, it comes down into the bladder, or it can be one that forms in the bladder itself. And as I say, people die with it without even knowing they have it, But normally, when people come to us with the kidney issues or the bladder issues, we always want to find out what the bone profile is, which means we have to look at the calcium levels, the magnesium levels. We have to look at the full blood count, and of course, we have to try and get a specimen of that stone if we can get it. And then, of course, that will give us an answer as to what it's made of, the constituent parts. So if it's calcium, then some certain foods that you might not need to eat, like, the lentils and the greens and things like that, because they're the ones that have got a lot of cellulose, and that can cause problems. But mainly, as I say, infection is one thing. And of course, the amount of calcium you have and these bone profile nutrients are the ones that probably would be responsible for that. But of course, there is also the genetic aspect of it, which is important not to ignore.
Thank you for that. Thanks for that response. And you did mention race as one of the factors in your penultimate slide. Now, yeah. Andrew is asking, is there a connection between race and the occurrence of stones? And if so, is there any sort of reason that's known, or is it one of those mystery areas where we still don't know why some races might be at a higher risk of getting stones than others?
Believe you me, if I was what do you call it now, a geneticist, I'll be able to answer that question, appropriately. But I just know we are more prone. If you look at the epidemiological, aspect of it, you would see that we're more likely to do that in terms of developing the stones than the other races. Now, whether that's just the way we are predisposed or not, I'm not sure. That may be something that is worthy of a research or something, and find out why it is we are more prone to this than that. But I know genetics plays a role, hereditary factors play a role, the kind of lifestyle you lead plays a role. People who smoke, a lot, people who drink a lot more alcohol, people with sedentary lifestyles, people who don't listen to their body's habits. Like, for example, you feel you want to go and have a wee, and you don't do that. And over time, obviously, the body gets used to that, and that encourages, all these anomalies and all these problems to happen. So whether it's entirely the race or not, I am not sure, and I couldn't put my money on that. But I think it's a multifactorial issue. There's a lot of factors embedded in the reason why we are more likely to develop that than others.
Probably an area that needs more research then, I guess.
Absolutely, yes.
Yes. Okay, thank you for that. And thanks, Andrew, for that question. Now, in terms of kidney stones, we know, and you've mentioned as well, that some kidney stones can pass on their own. Is there any idea of which kinds of stones might pass on their own and which ones may not pass and need intervention? And is there any sort of correlation between the size of the stone and the type of pain that someone might get? Or would all of them cause pain?
It's interesting you say that. I mean, I think the question answers itself. Obviously, the smaller the stone, the more likely you are to pass it. But that does not mean the bigger stones can't pass. You see what I mean? So it's a relative, question of relative understanding. But one thing I can tell you is, it's very paradoxical that the smaller the stone sometimes, the more painful. It's funny how that happens. By the time you get to see the stone, it might be just small, but because it's very sharp, the edges of it are very sharp. So when it goes into the tube that connects the bladder and the kidney, it gets stuck there. And all it does is, because it's sharp, it starts, sort of doing this stabbing motion in the walls of the ureter. And that is what causes the most pain, and that is what causes the bleeding as well. Because the more it does that, the more you get that pain. And this pain obviously is very upsetting because it doesn't allow you to sit or stand in one place. You just be, jumping up and down with the pain. So, but when the urine behind it pushes it down to the bladder, and then you're able to pass it out, most of the time that would be the end of your problem, because what was blocking it is now been removed, and that's the end of it. So you'd expect, because of the narrowness of that tube, you'd say the smaller it is, the more likely you are to pass it. But from the clinical presentation, we know the smaller it is, the more painful it is. And so the bigger it is, the more unlikely you are to pass it, and the more likely you are to require removal by surgery. Either they go with the camera or they go with the scope and remove it, or they even sometimes have to open. And I can say I've seen stones as big as 2/3 of the kidney. And of course, it causes a problem in the kidney where it is not functioning anymore and therefore has to be removed, But luckily, there may be the other one which might be functional. But as I say, the smaller it is, the more painful it is, and the more likely you are to pass it. The bigger it is, the less likely you are to pass it, but probably the less likely to cause you the pain that you feel. It's a paradoxical situation. I don't know if I'm making sense.
You're making perfect sense, yes, I guess. And also the bigger ones are more likely to get obstructed as well, because they're quite big, They are unable to shift out of place or move along, as Dr. Kamara said. So they're the ones that are likely to sort of cause blockage or obstruction as well. In terms of the hydration, that's a very important point, drinking enough and keeping well hydrated. I mean, as you've said, we need hydration for pretty much everything that goes on in the body. But in terms of hydration in the context of managing stones or even preventing stone formation, why do you think we get dehydrated? Because we're not, I mean, summertime, the weather might be hot, but even in the winter, people still come to A&E with, renal colic, kidney stones and all sorts. What do you think might be going on?
Well, as I say, see, what tends to happen is the hydration is good. And it's not like you hydrate today, you prevent the formation of the stone today. No, the stone could have been there. It could have formed because of what has been ongoing, what preceded it. You see what I'm trying to say? And so it's always important to remember that, we need to maintain a discipline of our body. And the more we do it, the better it is for us. As simple as that. We look after our body, as I said. Listen to your body. You know what you're looking at. You know what you have in your body. And like I said, you know yourself better than any doctor. So if you come to me as a doctor and say, I tell you what, this is not right. I don't feel right. This is what is wrong with me. Yeah, I have, the responsibility of listening to you, taking that on board within reason and acting upon that. And that's exactly what it is. So the hydration is just one aspect of it. the food that we eat, is another thing, the lifestyle we live. So as I said, it's a multifaceted approach. I mean, the hydration is important because, as I said, we need to maintain that 70-30 ratio, that 70-30 balance. If you, for example, I may be digressing, but I've seen someone have a large bowel movement. There's just one episode of diarrhea. And guess what happened? That person collapsed. Yeah. Because they lost like 1/3 of the whole of the body fluid in that one large diarrhea. And guess what? That diarrhea was not just diarrhea, it had blood in it as well. So it just goes to show you that you lose that, you definitely would have to pay for it in terms of compensating for it. And of course, if the heart is not getting what it wants, then of course the brain will not get what it wants, and then you begin to go into difficulties. So then it has to be replaced. And that's the issue I'm talking about. So maintaining that is good, but obviously it's less so in the winter in comparison to the summer. And this is why in summer it gets to be increased, because you burn more. Yeah. If you exercise, if I was sitting here in my office, for example, for 5 hours, I don't expect to be taking the 5 glasses of coffee or tea compared to somebody who's out there, even though it's cold and it's running. Yeah. Someone who's running will definitely lose a lot more because they perspire, the exercise is strenuous, the organs are working, the muscles are working. So you need to replenish what you lost. You see what I mean? And that is why I talked about the professional hazard. The military people, the athletes, people that do sports and things like that, they need that. It's not without reason that during football matches, you see them coming to get rehydrated. It's important. That's just telling you what it does to the body. Because without that, you don't function. And if you get dehydrated, guess what happens? Your possibility of developing clots is quite high. And if the blood clot forms in any organ, obviously that organ doesn't function as it should. So these are all things we have to take. As I say, we do that in moderation. But of course, the weather dictates the kind of lifestyle, the kind of profession, and what you're doing and the rest of it. These are all embedded in that decision.
Thank you so much. So let's make sure that we are maintaining a good lifestyle, not just at certain times of the year, but throughout the year. As Dr. Kamara said, it's a multifactorial approach, and all these lifestyle things that we've talked about, your diet, the regular drinking of water, hydration, avoiding smoking and reducing alcohol, etc., are all important. We do have a Healthy Heart session on Tuesdays, so do tune into those sessions to learn more about your diet and your lifestyle as well. Thanks for that, Dr. Kamara. So there's another question which says, it seems it takes a while to diagnose stones in the gallbladder. Then the treatments differ. Some people go for surgery and others are given medication. So this attendee wants to know, what is the best approach, please?
Right, okay. Well, the diagnosis of gallstones is not a difficult one. I don't think, because typically the patient, it's a sensitive thing. But as I said, there's 5 F's, they say, so female are more, the female are more prone to that. It runs in families, as I said. They're a bit overweight, some people who are politically incorrect say fat. So it's fat, fertile female, over 40 and fair. So the blondes and things, so according to what they've said, these are all people who are more prone. Whether that's the case or not is another thing altogether. But obviously, so when they come to you, typically, and I emphasize the word typically they come to you with pain in the right upper belly. Mm-hmm. Yeah. So they must have maybe had something like maybe lasagna, maybe fish and chips, maybe some gravy, something with lettuce or maybe some mayonnaise and all that. Anything that has got some fat in it, will trigger that, because when you eat the fat, the brain tells the liver that, look, there's fat that needs digesting. And so therefore, the gallbladder is triggered into action to produce the bile, which is needed in the small bowel for the digestion of this fat. Now think about it. As I said, the balloon effect, you told the gallbladder you want this, and the gallbladder is now full in process, in action, trying to push this. And of course, in the way of that bile, which is liquid, is this stone. So the stone is blocking the passage of this fluid or liquid into where it is needed for the digestion. And then what happens? It begins to stretch. If you imagine it stretching it like that, obviously, that's what happens. So it causes pain, it causes the blood supply to be compromised, and then that makes it likely to get inflamed and get infected. That would tell on the blood results that we the blood tests that we do, the results of them, because it's inflammation, the white cells will go up, yeah. And sometimes if it blocks the passage of the bile and then it goes back into the liver, it can cause problems with the liver enzymes. And so when we look at the enzyme, which we call bilirubin, yeah, that's what makes people yellow. If you look at the conjunctiva, when you pull the eyelid like that, you see. So when that goes up, and then the other enzymes go up, we know definitely that's what we suspect. And of course, there are times when you do an X-ray of the chest, and the belly, you can actually see them, the gallstones in the gallbladder sometimes. And of course, the ultrasound would give you that. Or if you don't have that at all, the CT scan will do that. So they're not difficult to diagnose at all. And of course, when you come to the treatment, as I say, most of the time, they settle. So the flare-ups do settle with the management. So you give the painkillers, which is absolutely vital. You then maybe try and avoid eating that kind of diet. So you change the diet. Instead of fat, you then look at maybe grilled, baked, boiled, and things like that. Less of that. And then of course, if there's any sign of infection, you give the antibiotics. So when that settles, that probably will be the end of that until another one happens. Now, if you have 5 or 6 or 7 of those episodes in 1 year, and they're now impacting your lifestyle, then of course it moves to the next level, which means you have to consider surgery, because now it's causing this person not to go to work. It's causing this person to lose financially. It's causing problems for the family and her health or his health and all that. So all of that combined is what the surgeon will decide. It's now time for us to do it. But remember, they wouldn't remove it when it's actively inflamed. They would have to wait for it to settle down, because if you try and get the gallbladder when it's inflamed, what happens? It's swollen. And when it swells, you lose sight of any of the anatomical aspects of it, especially when you're going in with the camera. You don't see anything. And if you unfortunately nick any of those ducts, then of course there's problems. There's a trouble. There's no question. So that's why the surgeons prefer for the inflammation to subside, get better, and then they can then schedule for operation. Remember, a planned operation is the best than the one that is just emergency, because anything happens. It's like anything goes. So when they plan it, it's better. But that's the trajectory. That's the phase work, and that's the way it works in terms of diagnosing it. But it's not difficult at all. I hope that's clear.
Thank you. So I hope that clears it up for the person who's asked the question. It's not uncommon that people will be back and forth to their doctors or to A&E with gallbladder pain. It's not a nice pain to have at all, and it really impacts people's quality of life. But as Dr. Kamara has said, when you've got an active attack of gallbladder or an infected gallbladder, that's not the time that they're going to be sort of taking your gallbladder out, unless of course you're in a life-threatening situation and there's no other option. So let's watch those dietary factors. It really counts. I think sometimes people forget, so they avoid the fats, things settle down, and then every now and again we might forget and we slip again, or we might eat something without realizing that it's going to trigger. But some people are really good with having their low-fat diet if they know that they've got gallstones. And as soon as they eat the wrong thing, they know. Because it's a very typical pain, isn't it, Dr. Kamara? It's in a very sort of specific location, and those who have gallstones know it when they get that pain in that right upper part of the tummy and feeling sick, etc. Right. So Edna would like to ask, if you've had kidney stones in the past, what do you need to do to avoid this in the future? So that is Edna's question to you. So maybe a brief recap. And then just to add on to that, Iyabo Fashion says, can eating beans, lentils be responsible for stone formation? So I'll just put those two together because they might be along the same theme.
Yeah, I mean, as I say, some people say once you've had kidney stones, you don't get to have them again. That's not true. The important thing is to find out whether there's anything there. Like, I'll be frank, sometimes the cancer can present with high calcium. And the high calcium can actually trigger the formation of stones in the kidney. So if, for example, you've come with a kidney stone, like renal colic, they call it, kidney stone. And then, of course, you get investigated. One thing I always do is, as I said, not only the blood test for the performance of the kidney, which is the renal profile, but you definitely would want to find out whether there is the possibility of getting this specimen in terms of what it is. And that's the only way you can actually find out what caused it. But by and large, that you can then do the calcium levels to make sure you're not missing anything else in terms of maybe a hidden cancer which is causing that, But as I say, because it's a renal thing, i.e. the kidney, most of the time the urologists are the ones that deal with this. Yeah. So they will definitely take you through a series of tests. And of course, if they are lucky to get the specimen, they'll look at it and examine it. And that way they'll find out what it is. And of course, as long as you find out what it is, you then would have to probably prevent that from happening by, not going close to that kind of thing. It's a simple thing, because if I find out what is wrong with me, I know this is what triggers it, I avoid it. So if someone is prone to having stones forming in the kidney, then there's certain foodstuffs that you want to avoid. And they say normally the greens you want to avoid, because these are things that trigger, the inflammation, that reaction, that pain you can feel, because they think it's more likely to cause that than not. Therefore, avoid that. Things like rhubarb, but mainly rehydration is important. And if you get the kidney stones, then obviously you treat it as best you can, but you'll be very, very lucky if you can get it out and then get it to be examined. And of course, then you can put an end to the question as to what it is, And if they find out, for example, when they're investigating you, there's something in the kidney that is actually making it prone to the formation of this, then that would be addressed. You see what I mean? So it's just a question of finding the cause and then, directing the treatment towards it. It's as simple as that, But mainly, the urologists are the ones that deal with this, and they are the best people to actually talk to you about in terms of the fact that you would actually benefit from a certain kind of treatment. As I said, if at all they blast it, and then it actually disappears and turns into rubble or maybe sand, and it gets removed, that does not necessarily remove the root cause of it. So when you get to the root cause, you then can deal with it, address it, and then that way you can actually reduce the possibility of, reformation, if that's the word.
Thank you for that.
Helpful.
Thank you for that.
All right.
So people can reform stones, and as Dr. Kamara said, if you are finding yourself in that position, please, I back what Dr. Kamara is saying, get yourself checked, because there could be other reasons outside of what we've discussed today causing these recurrent and stones, and very rarely cancer could be on that list. So any recurrent symptom, even recurrent UTIs in the kidney, for instance, especially in the elderly, recurrent stone formation, there are reasons for you to be looked at more closely to find out what's going on. If you think you're doing all the right things and you still can't explain it. Dr. Kamara, did you want to say something briefly about I know it's along the same theme, but I just don't want people to feel that we're not taking their comments on board. So do you want to say anything about the beans and the lentils, or do you want us to leave that for the dietitians?
Again, the beans are a very rich source of protein, and things like that. So I don't think there's any reason why, even if you're prone to getting kidney stones, that you shouldn't eat. If you eat it once a week, once a fortnight, I don't think that would come to anything, consequential, if you like what I'm saying. So I wouldn't deprive you of eating them, but that does not mean you have to indulge in a way where you do it on a daily basis. Like, for example, people have this habit of, doing things that they know that, like, you can actually predict them, in terms of what the diet would be. It's important to just vary it. And if you think when you've had the beans, you feel a bit more bloated, or you feel, oh, hang on, this doesn't suit me, then perhaps the less of it is better. But as I say, the beans, obviously, they're recommended, they're good. But if you have the tendency to actually get bellyache when you take the beans, then I'd suggest you eat less of it, or maybe if you can, avoid it, as best you can, and take it from there, really. But I don't think there's a direct link of the beans to the stones. That's what I'm trying to say, But if you think when you eat them, it actually triggers that, then the best thing to do is probably eat less of it and take it from there. Or better still, get investigated and make sure that you're not missing something else, because it's easy for you to think this is what it is, when in actual fact, something else is lurking underneath. And so therefore, get investigated and get to the bottom of it and take it from there, really.
Yeah, thank you. We want to have some options for food, don't we? So if we take the lentils off the list and we cross off the greens and we've taken the meat out and everything, soon we'll have nothing left. So as Dr. Kamara said, in moderation.
Absolutely, yes. Yes, in moderation is absolutely the best thing. Yeah.
Yes. Okay. Right. So do join that nutritionist session on Tuesdays. They go into a lot more details about the actual food components and things that are good to consume and not so good. What about tea consumption? Does that affect stones in any way? General stone formation, tea?
It's the tea, a lot of people don't know that tea has got more caffeine than coffee. There's tannin, and sometimes, I don't know if there's a direct link, but I know obviously tea has got a diuretic effect, in some cases, medicinal, sometimes blood pressure, it helps with that and the rest of it, but anything that is, as I say, liquid, whether tea or juice or fruit, it's important to remember that, do it in moderation. Now, I remember we had a patient who came very pale and, was a bit dizzy and, lethargic and things like that. And I'd lost some weight, and we investigated, did the blood tests and things and all that, and couldn't find anything, did all the x-rays, did all the CT scans, couldn't find anything. But she was definitely, losing blood somehow, and there was nothing there. But believe it or not, we then decided to go into the social, lifestyle, and we asked her, how do you spend your day? It was just a very funny question. And she said, I tell you what, for the whole day, I'll finish 4 jugs of tea. And I was like, what? Well, hang on. We looked at that and we found out that the tea she actually drinks has got tannin, has got caffeine. And that actually was what caused the problem of absorption from the lining of the stomach, because we know that's where this is formed. That intrinsic factor is in the stomach, the bottom bit of it to the duodenum. And so that's what the source of this lady's problems. So once we addressed that and corrected it, and I tell you what, she was a lot better. She developed a hemoglobin, and she couldn't thank us enough when we found that out. But it's a question of eliminating all the big things, and then coming down to the probable or maybe less probable. And it worked out really nice, but it just goes to show you that everything in moderation would be good, but anything in excess will definitely not be good for you.
Well done. Another life saved.
Thank you.
So there's another interesting question here. And I remember this as a child as well, when people used to say, oh, if you eat stuff with seeds in it, you can get appendicitis. So someone's question is, can guava seeds cause your appendix to get inflamed or even cause appendicitis? So please let us know, is this a myth or are you going to bust it for us?
It is a myth. The appendix is an appendage, as it were. I don't know if I can go back to it, you can say the appendix is just a small, like what do you call it now? It's like a small worm-like, appendage or organ that is just under the cecum, which is like a blind bowel. Now, times gone, in the years gone, the surgeons used to remove it. Any child or any adult who came in with abdominal pain, the pain in the belly, and especially in the right groin area, needed to have the appendix removed. But lo and behold, they found out that most of the appendices, that they removed were all normal when they took them and sent them to the lab for, because believe it or not, you can get a cancer of the appendix, a carcinoid of the appendix. That is known to happen. So every one of those that was taken out was sent to the lab to assess so that they don't miss that. And it turned out that 80% of the ones that they removed with the abdomen pain was, normal. And then, of course, the myth was that the appendix is one organ that stores stones. Well, there's nothing like that. What the appendix has is a lot of protective, cells for you. It's got lymphoid, tissues, which is like the defense of the body, part of the defense. So the lymph you look at that, which is defending the body, is a lot of it is in that appendix. So when they removed the appendix, they actually were depriving the children of that defense. So it turned out that that should not be done. In fact, nowadays, I can tell you that most of the surgeons, before they operate on an appendix, they depend on a CT scan or an ultrasound scan to confirm that. So it's a myth. The guava seeds or whatever seeds do not go into that. Absolutely not. It's something that has got a blood supply, and mainly that blood supply gets compromised. It's like blocked or it gets inflamed, and that is why it gets painful and causes the swelling, and then it causes the infection. And of course, when that happens, it needs to be removed. And when it's removed, that's the end of it. Some people used to think it's just an extra, but it's important to remember that. Just like you have the tonsils in the throat, that's how you have the appendix in the belly. And that's why it's important to keep it. But there's no way any stones will be forming it, not unless it's got like a blood clot that has turned into a stone. And then, of course, you can get that. But other than that, you wouldn't, guava seed or any other seed will not go into it.
Thank you for busting that myth for us. I really did wonder how that the seed managed to bypass all those enzymes in the stomach. But anyway, that was my childhood brain at work.
Indeed, yes.
Yeah, so Ngozi has passed on a message from the person who asked the question that's really interesting, a really interesting revelation, because that's what they were told, that it was the guava seeds causing that.
Yeah. Yes.
Thanks for that. So there's a comment from, so there isn't a name, it's just Huawei MediaPad. So there's a comment, I think it's in relation to the diet issue we talked about earlier on. And he or she is saying, but for kidneys, there are things like Stonebreaker which work, but at the end of the day, diet is essential. So I think the message is that at the end of the day, diet is quite a key component, and that's what we were talking about.
Absolutely. Absolutely, yeah.
So thanks for that comment. The same person has also said, I'm sure herbal tea is fine, like dandelion. So that's a comment from he or she as well. And then there's another question for you, Dr. Kamara, from our chat box. It says, I have been told I have a hiatus hernia and multiple gallstones, and the doctor is insisting that I have surgery, but I'm not doing that as I'm aware that there are herbal options. The pain I get is on the left-hand side, and I'm a vegan. So I guess this attendee would like to know your opinion on this.
Yeah, that's interesting. That's a whole topic on its own, but I'll try and be as simple as possible. Okay. Now, as I said, the gallbladder stones, the pain of that is mainly on the right. Yeah. And the hiatus hernia, I don't know if the questioner knows what that is. Sometimes people just hear the name and the doctors don't sit them down and explain to them what that is. So the food pipe, yeah. So if you look at the neck there, you see that bit there for the male, that bit, that protuberance is the Adam's apple, they call it. So that's the windpipe. And they're very close relations. Behind the windpipe, you get the food pipe. So the two together. And that is why sometimes you're eating the food and then, oops, it goes the wrong way and you start to cough. Mm-hmm. Yeah, because they're very close together. So that food pipe is called the esophagus. And it's like a tube that goes down and then it narrows as it gets to the point where it becomes the stomach. So that bit is called the LOS, which is the lower esophageal sphincter. It's a band of muscles like that. If you look at what I'm doing, that like that. So that muscle, all it does is it relaxes so that the food that has come from the mouth into the food pipe enters into the stomach for digestion. There's a reason for that. In the stomach, there's a very strong acid that is required for the digestion. And that acid needs to be kept there rather than go up into the food pipe, up into the higher part of it. Because in the higher part, it's a very mild alkali. It doesn't burn it. So because that band of muscle is there, it protects that to come from bottom up. And so you don't get that burn. But there are people who that band of muscle is laxed. Maybe you've lost your weight rapidly, and so as a result, instead of it being tight like that, it's a bit laxed like that. There's two types. So that is what we call a hiatus hernia. So there's two types. There is the one that slides and is the one that rolls. So there's two types. So the rolling and the sliding. Now, obviously, it's sometimes very difficult to tell when you look at the person. Even when you look at the X-ray, you might not see it, not unless it's big enough. So what I don't know is the surgery they're recommending for you, is it for the hiatus hernia or is it for the gallstones? This is what we need to establish, because the hiatus hernia, most of the times, does not get operated on, not unless it becomes, a problem, big problem that it impacts your life to the point where you can't live properly, and so therefore it has to be done. Now, the operation they do is called Nissen fundoplication, where you wrap the stomach around the food pipe where it becomes the stomach, and then it becomes a bit more of a holding mechanism like that, than when it's like that, when it's open. So that's the kind of thing that would be done. But as I say, nowadays they do it by camera as well, keyhole, they can do that. But then the gallbladder is a different thing altogether. Again, they don't just operate on that. Unfortunately, if you've got both, one thing you must remember is that the pain can mimic one or the other. So what we need to establish is the pain coming from the gallstones, or is it coming from the hiatus hernia, which can be equally painful, or is it both? And that's why probably if you want to meet me on a one-to-one, I can then maybe expand on that. But I think in the interest of time, this is what I think I can say so far. But I don't mind having a further conversation if that's what you need.
Thank you so much. I think that's really helpful. And if you do need further information regarding this, you can email health@CAHN.org.uk. And certainly you can ask some more questions in a bit more detail if you'd like to have that further input. Thanks for all the comments in the chat box. So lots of comments thanking you, Dr. Kamara. Someone said you're a very good teacher at breaking down things and making them simple. Someone also said that they've learned a lot. The attendee who asked the question earlier on, his name is Zakia. So Zakia, thanks for your comments and your questions and your contributions. And again, Nike is saying, thank you, Dr. Kamara, for such a brilliant session. Thank you, Dr. Diana. Thank you too. And let me just make sure we haven't missed anybody's question. Amazing work, Dr. Kamara, as well, is what we are having. So we've had a very interesting session. We've talked about stones in different parts of the body. And Dr. Kamara, you gave us a bit of a brain teaser at the beginning, and I think we didn't do too badly. People mentioned quite a few, but we've learned that you're keeping hydrated. Well done, taking your own advice. We've
Absolutely.
learned that.
You practice what you preach.
Absolutely, yes. No hypocrisy here. We've learned that we can have stones in all parts, different parts of the body, although we commonly know of kidney and bladder and gallstones. There are a lot more stones in different parts of the body, and we've learned all those lifestyle measures that we need to embark on to make sure that we minimize the risk. And for those who unfortunately have the risk nevertheless, then recognizing and doing something about it is really what's important. I'm hoping we haven't missed anyone out. I've gone back and forth on all the questions, and I think we have tackled everybody's question. But as I said, if there is anything that we haven't addressed, then please do feel free to email health@CAHN.org.uk. We appreciate your feedback as always, and thanks for completing those feedback forms. Now, any last words from you, Dr. Kamara?
Well, I mean, I thoroughly enjoyed, conversing with you this morning, and I'm grateful for the opportunity to be able to share my knowledge. But remember, you know your body is better than anybody else. Don't let anybody tell you otherwise, and I urge you to listen to your bodies. Any changes that you're not happy with, don't wait until that change becomes a change that you would have to live with forever. Because, as I said, a stitch in time saves 9. And literally, in this particular instance, it is important to do things when required. Anything you catch early, you have a very good chance of actually dealing with it as best as possible. So don't suffer in silence. Seek the appropriate advice, seek the appropriate channels. As it is, we are lucky here because we have the NHS and it's accessible for free at any point and anywhere in the country. I tell you what, we are the envy of the world. You go to other countries, America, you probably would see what I'm talking about, and you would know that. So a word to the wise, I say, is quite sufficient. So listen to your bodies and actually respond to them. Thank you so much for having me, and look forward to seeing you again.
Thank you so much, Dr. Kamara. And just some icing on the cake, I must read this comment from Neville Levy. He says, this was very much more interesting than I first thought. I've been able to learn a lot. So
brilliant, wonderful.
That is great. And we're grateful that even if one or two people really learn a lot and it changes somebody's life, that we've accomplished something. So thank you for...
That's the Holy Scriptures you just quoted.
You see how the Lord is using you.
Absolutely.
God bless
Thank
you.
you.
Allah bless you. Allah bless you. Right.
Thank you so much.
I'll hand over to our Able Comms team. And once again, thank you to everyone who's joined us on this session. My name is Dr. Diana Asante. I've been your host for today. It's been a pleasure as always. And I hand over to the team. And we look forward to seeing you again next week. Please hold on for the rest of the program. Over to you, Sandy. Thank you.
Perfect. Thank you very much, Dr. Diana. And thank you, Dr. Kamara. I mean, thank you is never enough, especially with you. You've been with us ever since. So thank you so much for your time today. And thank you everybody else for your time this morning and every Saturday, for those of you who join us every Saturday. So just to share a few updates with you, So next week, on Saturday the 3rd, we have Dr. Diana. She's not going to be the host, she's going to be a guest speaker, our lovely Dr. Diana Asante. So the topic will be health and well-being during festive seasons. We know that we'll be having a lot. You can see the table on the picture there. I can imagine for some of us it'll be a lot more than that. Nice, lovely African food. So, but please attend the session next week and listen to the lovely tips Dr. Diana will share with you. So the next session we have will be the Health Hour. The Healthy Heart. Healthy Heart is every Tuesday from 6 p.m. to 7:30 p.m. So the next session will be on the 29th. So the topic will be, is keto diet a fad diet? Again, if you'd like to know, please join us and find out. Also, we have a physical instructor at the session. Please do join us. So yeah, we also have, just before, we can have the next slide, but just before I say anything on this slide, we have a session this afternoon at 1 p.m. It's a session we're organizing in collaboration with the Home Office, but I'll just like to stress that it's a very confidential session because it can be very tricky when we're dealing with the Home Office. Please do share the details with your friends and family. I've shared the link in the chat box, it's on Zoom. And we know that in our community there are various issues with immigration, so please do attend and ask as many questions as you can. The topic the topic will be, if I get it right, I think it's on domestic violence, but yeah, I think I posted that in the chat box. We also have an advocacy service, advocacy and DVSA service. Looks after our community. So if you have any challenges when it comes to advocacy, whether it's with the housing, employment, or anything else, please do contact us. We also have a lovely counseling service, culturally appropriate. Most of our services are culturally appropriate, so please feel free to signpost people to us and come to us as well. And we also started a campaign to reduce suicide. We know that unfortunately amongst our community it does happen, even though we don't really talk about it. So if any of this is of any interest to you, please do email help@CAHN.org.uk. The helpline is also open from 9 a.m. to 9 p.m. and it's 07710 022 382. And a massive thanks to our partners. Next slide, please. Yes, so massive thanks to our partners. Massive thanks to our comms team. So we have RAFA International Development Agency in Birmingham. We also have the Black Health Initiative. Thank you for your participation. We have the Croydon BME Forum. Thank you, all of you, for being on the call. We have the Enfield Caribbean Association. Thank you again for sharing all the messages. We have the Royal Assembly Redeemed Christian Church of God. Again, thank you very much for all the work you do. And that's everything for us. Thank you very much. Have a lovely weekend. And massive thanks, Dr. Kamara and Dr. Diana. Have a lovely weekend, everyone. Goodbye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.